If you're just joining us, welcome everyone. We're just going to wait another minute to allow everybody to kind of pop in from the waiting room. So glad that you're able to join us this evening for our strategies for managing life after a brain injury. Before I go ahead and introduce our presenter, there's a couple of little housekeeping things I'd like to take care of. My name is Prem Kaur, and I'm from Cavernous, Malformation, Canada. And I'd like to do a land acknowledgement before we get started. So this webinar is taking place from Edmonton, Alberta. And I'd like to acknowledge that we are on Treaty 6 territory, a traditional meeting grounds, gathering place, and traveling route to the Cree, Saulteaux, Foto, Blackfoot, Métis, Dene, and Nakota Sioux. We acknowledge that all the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. Also, for our webinar today, we are going to have some opportunities for questions and answers, and that will take place at the end of the presentation. And if you have a question that you would like to be asked, please put it in the Q&A, which is at the bottom of your screen. And because we're recording today's webinar for other participants who were not able to attend or other people who could not attend, we ask that your questions don't have any kind of personal information in them. And if for accidentally you do put something, I'll make sure I edit it before I ask the question. If this is your first time using a webinar and you're kind of wondering why you don't see any other participants, it's totally normal. Just for your awareness, webinar forum is slightly different than the meeting forum. So I'd like to go ahead now and introduce our speaker for today. Kaylee Owens is an occupational therapist working at the Brain Care Center in Edmonton, Alberta. Here, she supports adults with acquired brain injury to increase their independence and improve their quality of life. Kaylee is passionate about working with people holistically with clients and addressing their physical, cognitive, and mental health needs to help them achieve their goals. We're really excited to be able to provide this webinar tonight. And with that, I'm going to go ahead and hand it over to Kaylee for the webinar.
Okay, awesome. Thank you very much. I'll go ahead and share my screen here and we can get started. Okay, so thank you for the introduction. As Prem said, my name is Kaylee and I'm an occupational therapist in Edmonton, working with adults with acquired brain injury. So here's the purpose of my presentation this evening. I'm planning to firstly go over the common difficulties that people with acquired brain injury face, and then I will do an overview of the occupational therapy strategies that can help with these challenges. I'm hoping that at the end of today's presentation, everyone is able to leave with a better understanding of the OT role in brain injury and hopefully a couple helpful strategies to apply to their lives or their family members' lives as well. Just a little bit more about me. As I mentioned, I'm an occupational therapist. I work at a nonprofit called the Brain Care Center in Edmonton, Alberta. At the Brain Care Center, we work with adults with acquired brain injury who live in the community. We have a moderate to severe brain injury program and a concussion program. Our services include service coordination, occupational therapy, counseling. We have groups and classes. We have an assistive device technology program, which is teaching people to use their phones or other electronic devices. We have a caregiver support program, and we have a volunteer program. My job at the Brain Care Center is to help clients develop strategies and tools to assist them with their daily living challenges. I work with clients in both one-to-one appointments and also in group settings, such as life skill classes. In one-to-one sessions, I collaborate with my clients to set goals to increase their independence and their quality of life. And then we work towards these goals using strategies and guidance. In life skills classes, I teach strategies that address specific topics and have clients learn together and share strategies. So for example, at the Brain Care Center, I lead a memory group and also a meal planning and budgeting group with clients. Lastly, I do also support clients indirectly by liaising with other professionals or resources in the community to make sure that clients are supported and accessing the necessary services. So depending where you live and which clinics or OT practices are available to you, you may have the option of OT groups or one-to-one OT sessions as well. Before I go more into the common limitations found after brain injury, I just wanted to talk about the structure of my presentation today. I will be following the Pomodoro technique today, which is a strategy that I frequently use both myself and with clients to improve attention and reduce cognitive or physical fatigue. So Pomodoro is Italian for tomato. This technique was developed by Francesco Cirillo and named after his tomato-shaped kitchen timer. How it works is you focus on a task for 25 minutes, then you take a 5-minute break and repeat. After usually 4 work blocks, you take a longer break, so maybe 20 or 30 minutes. This helps people to stay on task and prevent getting cognitively fatigued, which can lead to issues with distractions and trouble focusing, especially after a brain injury. So today we will have 2 25-minute work blocks, which will be me presenting. Between these blocks, we will take 1 5-minute break for everyone to refill their beverages, use the washroom, and rest their brains. I will lead an optional breathing exercise during the 5-minute break, so feel free to join me for that if you want. And then following the second work block or 25-minute presentation, I will open the floor to questions. Okay, so let's get into the common limitations that we see after brain injury. So this is, of course, not an exhaustive list, as there are so many areas that can be affected by a brain injury, but I did my best to summarize the areas that we see most commonly affected. I will go into each area more in the coming slides, but as an overview, the areas are physical, perceptual, cognitive, communication, and emotional. Okay, so after a brain injury, people may experience a variety of physical issues. The first one listed here on the slide, which is very common, is mobility changes. Depending on which area of your brain was affected, movement is also often affected. After a brain injury, someone may now require a walker, a cane, or a wheelchair, which changes the way that they get around and how easily they are able to move around. Of course, with mobility changes also comes balance challenges. We see people experiencing dizziness, visual or vestibular issues, and all of these things can affect balance. There is usually a higher risk of falls after a brain injury because of this. So walking aids, again, like a cane or a walker, can be a good way to keep people balanced and safely navigating in their communities. The next point on the slide here is fatigue. So specifically, here we are talking about physical fatigue. Following a brain injury, people often need to put in increased effort to complete physical activities. So even just walking, from the store to the parking lot. So due to this, they may tire more easily, or they might take more frequent rest breaks or even naps. We also see changes in hand and arm function after brain injury sometimes. Some people experience hemiplegia, making it difficult to move and use one of the arms or hands. Other people experience difficulty with fine motor control after a brain injury, making it hard to do smaller tasks like handwriting, knitting, or cooking. Due to the changes in someone's body following a brain injury, we also see an increase in overall reported pain levels after a brain injury. And of course, pain can also contribute to fatigue and reduced mobility. Okay, and so next we have sleep. I'm kind of lumping this in with the physical limitations after a brain injury, but it's physical and psychological, really. And so after a brain injury, we see that sleep is commonly affected. We see hypersomnia in some people, which means difficulty staying awake and alert during the day, despite having sufficient sleep. In other people, we see insomnia, which is difficulty with sleeping. We see both types of insomnia that are on the slide here. So we see onset insomnia, which is trouble falling asleep, and maintenance insomnia, meaning difficulty staying asleep. These changes in sleep after a brain injury are sometimes due to the brain injury itself, impacting the areas of the brain that control sleep. And there are also other brain injury related factors that affect sleep, such as pain. So if your pain level has increased, it impacts your ability to comfortably sleep. a change in activity level. So if someone is no longer going out to work and socializing, they might not be tiring themselves out enough to sleep at night. Stress, of course, with a new brain injury comes a lot of stress, grief, and change, and these psychological factors can frequently affect sleep as well. Okay, so the next area affected by brain injury that I wanted to touch on is perception. I briefly touched on this in the physical section when mentioning how vision can be affected by brain injury. Vision can change in many different ways after a brain injury, so it can affect depth perception, our understanding of the relationship of objects or our bodies in space, and it can affect how we judge distance. Brain injury can sometimes also cause blindness or low vision. Another perceptual issue that sometimes happens after a brain injury is something called neglect. Neglect is an impairment of attention and perception that happens when someone's eyes still work properly, so they can see their entire field of vision, but they have a hard time actually paying attention to one side of their vision, causing them to miss things on that side. So the pictures on the screen here of the clock, the house, and the flower that are missing half of them are drawn by somebody with left neglect. Another perceptual issue that is common in brain injury is hypersensitivity to light and sound. This can make it difficult to drive, to go out to public places that are busy and bright, or to continue working if you work in a busy environment. The next area that we see commonly affected in brain injury is cognition. So this is a really big area because there are so many different areas of cognition, and we often see many of them affected after a brain injury. But on the slide here, we have memory and attention. So difficulties with memory or attention can range from mild problems, such as occasional difficulties remembering names, for example, to severe, where events happening just a few seconds ago are not remembered. Oftentimes, people's long-term memory of their past is less affected, but their brain has a harder time forming and solidifying new memories. We also see people who report difficulty focusing on things and getting more easily distracted. The next point here is executive function. This refers to higher level cognitive functions, including planning and organization, task initiation, impulse control, decision-making, flexible thinking, and self-monitoring. These higher level functions are controlled by the frontal lobe. The frontal lobe is particularly susceptible to damage following a brain injury due to its location at the front. Therefore, due to its location at the front and also because it's so large. But also it's connected to many other areas of the brain. So therefore, damage to the frontal lobe or other areas of the brain or the connections between them can all lead to problems with executive function, which is why it's so common. Executive function difficulty can make it harder to manage your schedule, to cook, or to complete schoolwork, just as some examples. The next point here is insight and judgment. So sometimes after a brain injury, someone's ability to judge the safety of a situation or a decision might change. This can make it hard to safely live independently. Also, we sometimes see a lack of insight, meaning that someone might not always be aware of their deficits. When there is a lack of insight, it is even more challenging to work on strategies because in this case, they may feel they don't need the strategies. And then the last point I have here on the slide is communication. Our cognition affects our communication, of course. It affects our ability to pay attention in conversation, remember what was said, and to pick up on social cues. So with a cognitive impairment, it can be harder to socialize, and it can be harder to feel confident to socialize as well. Which brings us to communication. There are also communication disorders themselves that can result from brain injury. There are many. I'm highlighting two here. So aphasia is one type of many communication disorders. It is commonly seen in brain injury clients. Aphasia can be expressive, which results in people having difficulty expressing themselves through language or spoken or written language, despite knowing what it is that they want to say. Or it can be receptive, which impairs someone's ability to understand the meaning of written or spoken words. In some cases, when someone has both expressive and receptive aphasia, it's considered global aphasia, and they will have a harder time with all forms of written or spoken communication. Apraxia is another form of communication disorder. It occurs when the damage to the brain makes it difficult for someone to form motor plans for movement. This makes it hard for the mouth and tongue muscles to do the movements required for speech in a coordinated pattern. Okay, so the last common difficulty I want to review before going into the OT strategies is emotional difficulties. So after a brain injury, there may be damage to parts of the brain that previously helped with emotional regulation. People often report feeling more short-tempered than before and maybe having less of a filter than they used to have. Also, the life changes that come along with having a brain injury can make the emotional impact of the brain injury even higher. So, for example, changes in your ability to work or attend school, or changes in relationships, changes in your ability to do your hobbies, and changes in your ability to socialize are all things that can make coping with a brain injury more difficult and contribute to those emotional problems. Okay, so now we are going to get into OT strategies for each of these commonly affected areas. The first one is strategies for dealing with fatigue. Fatigue can be physical, cognitive, or emotional. And even though we are talking about it as physical right now, these strategies can also be applied to cognitive or emotional fatigue. The 5 P's of energy conservation are number 1, prioritizing. So when we are working with less energy, we need to be able to prioritize, decide what needs to be done today, and what can be done at a later date or time. Also, what needs to be done by you personally versus maybe what could be delegated. This might mean paying someone to help if that's within your means, or asking for help from family or friends. Or sometimes we just have to let some things slide. The next P is planning. So this is strategically planning when, where, and how you are going to do things. Our energy levels fluctuate throughout the day, so we should try to plan the most demanding activities during our best time of the day and less demanding activities when we have less energy. It can also be helpful to group tasks by location. So if there's a bank by the pharmacy, instead of making 2 trips, maybe you could do them on the same day. And having a plan also helps to offset the cognitive fatigue of trying to plan in the moment. So I recommend looking at your schedule, thinking about how much energy certain things will take, and then planning accordingly. It's best to look at the day before and after too, to make sure that you don't plan a day or a week that's too demanding for you. The next P here is pacing, and pacing is all about taking breaks and listening to your body's warning signs. It is better and more efficient for our body's energy stores for us to take more frequent short breaks than it is to wait and then just take a couple long breaks. A timer can be very helpful for remembering to take these frequent short breaks. So if you think you're going to forget, I recommend using a timer. You can also try to plan your schedule so that you are alternating between physically demanding, like going for a walk, and cognitively demanding activities, like paying bills, so that you can give each area a break while you do the other activity. The next P we have here is positioning. So with fatigue, it's important to consider body mechanics, especially if you're experiencing a lot of physical fatigue. So, for example, if cooking is tiring for you, could you sit down to chop the fruit and vegetables instead of standing at the counter? You also want to consider your environment. Is there a way to minimize light or noise if those are issues for you? The last P is patience/permission. So we need to be patient with ourselves and give ourselves permission to take breaks and to ask for help. If we push through fatigue too much or refuse to ask for help, we often end up pushing too hard and paying for it by crashing for a day or more. Physical interventions in OT for mobility, balance, pain, and upper extremity function are quite specific to the individual because brain injury impacts physical function in such different ways. Also, physical interventions in the hospital or an inpatient rehab might look different from a community OT, but as a community OT, here are some of the OT interventions that I use for these issues. So the first one is if upper extremity function has been impacted, I will assess current function and then provide somebody with functional exercises involving moving the hand and arm in ways that will help them to rebuild pathways and movement patterns. So for example, if someone wants to work on coordination, I will sometimes have clients pour water back and forth from one cup to another, working on the hand-eye coordination of that. In addition to exercises, OTs can also help you to come up with creative solutions or adaptive strategies for function. For example, I sometimes teach clients how to tie their shoes with only one hand, or will recommend that they purchase a long-handled sponge so that they can still wash themselves in the shower. When someone is having difficulty with balance and mobility, or if they are reporting falls, I will typically complete a balance assessment and a home assessment to see how well they get in and out of the shower and on and off the toilet. Based on these results of the assessments, I will recommend equipment like a walker, cane, shower grab bar, stuff like that to reduce fall risk. Additionally, I can provide clients with balance exercises, but I do also often recommend that they go to physical therapy for even more in-depth balance exercises. And then lastly, pain is a big and complicated issue because there can be so many reasons that somebody is experiencing pain. And I always recommend that they talk to their doctors or specialists about it. But in addition, I do provide chronic pain education to clients so that they can better understand what is happening in their bodies. And I can provide light stretches and exercises to assist in pain management. Additionally, we can also use adaptive strategies and pacing to make sure that they can still function in their day-to-day lives despite their pain. Okay, so next we will talk about OT strategies for sleep. The first factor that I address with people just to make sure everything is optimized for sleep is the lifestyle factors that are associated with sleep. So our first point here is that it is best to limit caffeine and alcohol before bed. Caffeine is a stimulant and will keep us awake, so we want to keep that as far from bedtime as possible. Alcohol makes us feel sleepier initially, but it actually interrupts the quality of our sleep. The next lifestyle factor is exercise. The more energy we expend during the day, the more sleep we will need at night. So exercising is a great way to burn some energy and improve your sleep at night. However, we do recommend not doing any heavy exercise 2 to 3 hours before bed because this initially has an energizing impact right when you exercise. So do it a little bit earlier if you can. Naps are another thing to consider if you're having difficulty sleeping. As I mentioned before with fatigue, sometimes after a brain injury, someone requires more rest or even daytime naps. However, if someone is napping during the day and they're unable to sleep at night, they might just be sleeping too much during the day. So if you or someone you know is having trouble sleeping at night, I recommend cutting out naps to see if this improves your sleep at night. It might take a few days for your sleep schedule to adjust, but if you are able to avoid naps during the day, it should pay off with a better sleep at night. If you are unable to avoid napping during the day, though, we recommend napping for less than an hour and before 3 p.m. And another lifestyle factor that can impact sleep is light exposure. It has been shown that getting 20 to 30 minutes of sunlight as soon as possible once you wake up is a great way to help regulate your circadian rhythm, which can help with setting your internal clock to be awake during the day and then sleepy at night. And then last, for lifestyle factors, we have probably all heard that having a consistent sleep routine can help with sleep, and it is true. However, it's hard to force ourselves to go to sleep at a certain time each night, and this can increase feelings of frustration when it comes to sleep if we try to sleep at a certain time, but we are unable to. So to get into a consistent sleep schedule, I actually recommend starting with waking up at the same time each day because we can control this more easily than when we fall asleep. So just set an alarm, try to stick to getting up at that time instead of snoozing the alarm. This might be hard for the first few mornings, but gradually your sleep schedule will shift and you will get sleepy earlier in the evening due to your earlier mornings. The next point here on the slide is physical factors that affect sleep. Pain can, of course, affect sleep because it impacts our comfort in bed and being able to get into a position that is comfortable. OTs can sometimes make recommendations for positioning or cushions, but it's very specific to the individual and their sleeping environment or their pain. Using pain management strategies that work well for you before trying to sleep can help to make sure the pain is lower before you try to sleep. After a brain injury, some people deal with incontinence or less ability to hold their bowel or bladder, which can result in more trips to the washroom at night. And this also happens as we age. So one way to decrease these bathroom trips is just to limit your water intake for an hour or two before bed. If you are thirsty, you can definitely have water, but we would recommend taking smaller sips and only what you need. Focus on staying hydrated throughout the day so that you don't need to drink a lot of water right before you go to bed. Next, we have psychological factors. The biggest piece in psychological factors is stress. Of course, if we feel stressed about our day-to-day lives, we have a harder time sleeping. But also, sometimes we aren't stressing about life things, but we are stressing about sleep itself. So, for example, worrying that you won't get a good sleep tonight or laying in bed awake and feeling stressed about not getting sleep. So to address this, I will review strategies such as deep breathing, listening to a guided meditation or sleep story, and progressive muscle relaxation with my clients to find a strategy that works to help relax. We also discuss our sleep mindset and try to change the way that we think about sleep so that someone can decrease their stress around sleeping or not sleeping. Stopping clock watching, so checking the time frequently when you can't sleep, is a great way to decrease stress around sleep. So trying not to look at the time frequently when we can't sleep. Lastly, with psychological factors, I will also often encourage clients to develop a 2 or 3-step bedtime routine that involves relaxation and no electronics. For example, maybe it could be stretching for 10 minutes in the living room, then getting into bed and reading, then turning off the light and doing progressive muscle relaxation until you fall asleep. If you do your routine in the same order every night, your body starts to predict your routines. And once you start it, it will start releasing the sleepy chemicals and help you get a head start on sleep. Last factor here are environmental factors that impact our sleep. I will encourage clients to look at these as well, since they can sometimes be easy fixes. So we need a quiet environment to sleep. If there are noises outside of your control in your environment, could you use earplugs, a white noise machine, or run a fan to block it out? We also need dark to sleep. This could mean getting thicker curtains or blackout blinds, turning off the TV or any other screens in the room, or using an eye mask if there are light sources that you can't block out. We also ideally need a cooler room to sleep, which I know is hard with our current weather here in Edmonton. It is harder to sleep if we are hot, yet we cannot always control the temperature in our homes. So use a fan to stay cool, use light sheets or blankets if you can. A clutter-free or clean environment is easier to sleep in. It's just more stress-free and easier for our brains. And then last, of course, the actual bed and pillows that we use are important. So we want to use things that are comfortable. So make sure you find what works for you. Okay, the last area before our first break is perception. So some strategies for dealing with issues with perception. Some OTs actually specialize in visual rehabilitation. So if you're having issues with depth perception, double vision, or visual tracking, I recommend researching visual rehabilitation in your area. I don't specialize in visual rehab, but here are some strategies that I can use with my clients who are having perceptual difficulties. So for people experiencing neglect, which we talked about earlier, we can teach them visual scanning strategies so that they remember to scan all of their visual field instead of favoring one side. This can help them to be safer living independently or navigating the community without bumping into people or things. So one example of a visual scanning strategy is the lighthouse technique, which is coaching people to picture their visual scanning as the light of a lighthouse, slowly scanning all the way from left back to right. Then we will set something up for them to scan once we teach them the strategy, like a large bookcase, and ask them to find specific books, requiring them to scan the whole thing thoroughly. For visual deficits, we also recommend that clients and families organize drawers and cupboards and keep everything in the same place to make things easier. So a few strategies for sensory sensitivity to light or noise. The first group of strategies are considered compensatory strategies. These are used to kind of mask the problem to allow people to keep functioning. So for example, compensatory strategies would be wearing tinted glasses in bright environments or earplugs in loud environments. We will recommend these things if they are the difference between someone going out and working or leaving their home versus someone just staying home. So it's a good way to help somebody ease back into a variety of environments. However, we do recommend caution with compensatory strategies because if we shelter ourselves too much from lights and noises, then our brain forgets how to process them properly, which actually can make the sensitivity worse. Which brings me to the second group of strategies, which are desensitization techniques. This involves exposing yourself to the things that are increasing your symptoms. So for example, bright lights in small manageable doses to actually gradually increase your tolerance over time. I recommend this for most clients who are experiencing issues with light and noises and are avoiding them. We just need to make sure that we do it in small increments to make it doable because we don't want to massively increase symptoms. So for example, if you always wear tinted glasses out to the store, you could start by taking them off for just 2 minutes while you're inside the store. And then if this is tolerated okay, next time maybe you could try 3 or 5 minutes and so forth. Okay, so because we're following the Pomodoro technique, we're at our time for our first break. Everybody, please do what you need to do, whether that's washroom, refill a drink, just rest your brain. We will resume at 6:35, or 6:35 Edmonton time, 5 minutes from now. And while we are on break, I'm going to lead us in a breathing strategy. So as I mentioned, in sleep, deep breathing can be a helpful strategy for helping us relax before we want to go to sleep. And there's a technique that I often recommend to clients that can help them stay present with the breathing strategy, because sometimes we have difficulty with focusing on breathing and it gets kind of boring and we get distracted. So what I'll introduce today is a hand tracing breathing technique. So you can follow along with me if you're watching. We start with having one finger down near our hand here. You don't need to hold your hand up like me. It can just be down on your leg. And if you're not able to use both hands, you can trace your hand with your eyes and just kind of track it up. But if you can use your hand, you're going to start at the bottom here. And we're going to inhale as we bring our finger up to the tip of our thumb. When we're at the tip of our thumb, we will pause and hold our breath for a couple seconds. And then we will exhale on the way down. And we'll do that for each finger. So I'll lead us through it. We can start now. So inhale and trace up. Hold here at the top. And then exhale. Inhale up. Pause. And exhale down. Inhale up. Pause. And exhale down. Inhale on the way up. Pause. And exhale on the way down. Inhale up. Pause. And we'll exhale on the way down. So that's one of many breathing strategies that are out there. If you liked it, if you think it might help you, I recommend that you use it both for managing stress and for falling asleep, and really whenever you want to use it. I like the hand tracing part because it keeps us a little bit more active. When we're just sitting there breathing, we're more likely to get distracted. So that's why I often recommend the hand. We have 2 more minutes until our break is over. I'm going to have some water. So everybody just enjoy your last 2 minutes before we resume. Okay. That's the end of our 5-minute break. I hope everybody used it wisely and felt it was refreshing for them. And if you did, then maybe you should use the Pomodoro technique more often in your day-to-day lives. But we'll continue now because we have lots to do in our second half of the presentation today. So now I wanted to get into the cognitive strategies in OT. We will start with strategies for addressing difficulties with attention. So it is important to note that attention is actually the first step in making a memory. So if you didn't pay attention to something in the first place, then you won't remember it later. Because of this, sometimes people think they have a memory issue when it might actually be an attention issue, but oftentimes it's a little bit of both. The first strategy I have here for improving attention is minimizing distractions. So auditory distractions like the TV, the radio, music, those should all be turned off if you're struggling to focus. If you like to listen to music while you work, music without lyrics is typically less distracting. And of course, noise canceling headphones or earplugs are also a great way for minimizing those auditory distractions. Another type of distraction that people think less about, I think, is visual distraction. So our brain needs to process every single bit of visual input that it gets. So anything that you can see could technically be considered a distraction for your brain. This is why it's important to declutter our workspace and only have the task at hand in front of us. So if you do get distracted easily, it could also be helpful to, close the curtains or face away from windows because it is easy to get distracted by what's going on outside as well. The next strategy is taking short, frequent breaks, which we heard earlier when discussing fatigue. This is recommended because we can only focus for so long before cognitive fatigue starts to set in, which presents itself as a lack of focus. And this is why we practice the Pomodoro technique, working for 25 on and 5 off. As I mentioned before, one of the best strategies to use to make sure you are taking breaks is to use a timer. So you could decide how long you can typically focus on something until you feel like your focus is breaking and you need a break. Then I would recommend subtracting a couple minutes from that and then start a timer for that long. So for example, if you feel you can focus on reading for 20 minutes, then you usually start to become distracted. You could set a timer for 17 or 18 minutes and then start reading. When the timer goes off after 18 minutes, reset the timer for 5 minutes and take a 5-minute break. When it goes off again, you can reset it for 18 minutes and go again. So essentially, you can use the timer to stay accountable and make sure that you don't forget to take a break, and also that you don't forget to resume what you were doing after your break, which is also important. If you take breaks early before your brain gets fatigued, so at 18 minutes instead of 20 minutes, then you allow your brain the break it needs before it gets overly fatigued. It's always good to practice taking a break before you start feeling unfocused. The next strategy is breaking a larger task down into many smaller pieces. This can help us to focus on just one thing at a time instead of feeling overwhelmed by all the moving parts. So when you have a large task to do, first sit down and write out each step that you will need to take in the order you will need to do them. And then just focus on doing each step one by one and not moving on to the next step until you have finished the one before it. Using a checklist is good because it can help you to stay organized, and it feels good, honestly, to check things off as you go. So I recommend using a checklist. The last strategy here on the slide is the PQRST technique. This can be used when we are trying to study a chapter, study a chapter of a textbook for school, but it could also be applied to watching or trying to remember an episode of a TV show or a movie even. So we'll start with P, which is for previewing. So we preview what it is we are going to watch or read. So we could read the description of the chapter or read the description of the movie so that you have a general overview of what it is. Next is Q, which is to ask yourself questions about the movie you're going to watch or the chapter that you're going to read. So based on the description, what questions do you have? Some examples could be, what will the main character be like? Which character will I like the most? Or what will I learn from this? Then R is to actually read the material or watch it if it's a movie or show. As you watch it or read, try to find the answers to your questions. This can kind of keep you more on task as you go. S is for summarize. When you are done watching or reading, summarize what you just watched or read to make sure that you didn't miss anything important. If your summary is confusing to read, maybe you need to go back and reread or rewatch because you probably missed something. T is test yourself on it. This is more for memory than for attention, but if you want to, you could revisit the chapter of the book later or the movie and test yourself on what you remember from it to see if the strategy helped you to pay more attention and retain the information any better. Next, I'd like to talk about memory strategies. We will talk about external memory strategies first, such as writing things down and remembering them with the help of something external, so outside of our brains. Sometimes there's resistance to the use of external memory aids out of fear of becoming dependent on them or that it's a sign of weakness, but this is definitely not true, especially in today's world where there's so much to keep track of and remember. Using external aids helps to reduce the load and the stress on our brains, which actually helps us to remember things better. So I rely on my external memory aids, and I highly recommend that you allow yourself to do that as well. The first external memory strategy that I wanted to discuss today is to-do lists. So writing down a to-do list of the tasks that you need to complete is a great way to make sure that you don't forget to do anything important. You could make a daily to-do list, a weekly to-do list, or an ongoing list of everything you need to do, whatever best fits your needs and the number of tasks that you have. The brain dump method, which is on the slide here, is a way of breaking down a to-do list. You start by writing down every task you need to do, and then you sort it into a top 3, so the things you should do first, an easy 3, which are the things you can do easily when you don't have a lot of time or energy, but you still want to be productive, and a next 3, which are the things you will complete after the top 3. You could also sort your list by energy demand, by priority, or by day of the week. If you use the to-do list strategy, you will need to make sure you are consistently updating it so that you aren't forgetting things, and make sure to cross them off when you've completed them so that it doesn't get confusing. The next external memory strategy I wanted to discuss is checklists. So of course, you could make your to-do list into a checklist and check things off as you go, but also you can use checklists for things that you wouldn't usually make a to-do list for. So for example, checklists are great for reminding you of things to bring when leaving the house so that you don't forget anything important, or a list of chores to complete, a grocery list, or a packing list when going on a trip, or a list of people you want to give gifts to at Christmas time. Essentially, you can use a checklist for anything where you are concerned about forgetting something. You could use a paper and pencil checklist, or you could download an app or use the Notes app in your phone to create to-do lists or checklists. The next external memory strategy to review is a very important one, which is calendars and day planners. Many of you are probably already using calendars to remind you of important things like coming here today, or appointments. And as you can see on the slide here, we can use, again, pen and paper calendars, like that one there, like a book, or we could use a phone calendar or a computer calendar. If you aren't already consistently using either a calendar or a day planner, I highly recommend starting, because this is a great way to make sure that you don't double book yourself or miss out on important plans or appointments. You will need to consider whether you'd like to use an electronic calendar or a paper and pencil calendar, or if you prefer a day planner format, which looks more like an agenda or a book. When using a calendar, it's important to make sure that you check it frequently and update it frequently. Otherwise, it won't actually help you to remember anything at all. When you are putting something into your calendar, it's good to add as much detail as possible. So what the event is, where it is, what time it's at, how long it will take. And if you're using an electronic calendar, make sure you add alerts to remind yourself of the upcoming events. Consistently using a calendar, in my opinion, is one of the best ways to stay organized, and it really does support your memory and can make you a lot more independent in your day-to-day life. Remember that there are apps for lots of these things. Some are paid and some are free, but I encourage looking into them if you want an app to help you with your organization. I often recommend Google Keep for to-do lists and checklists because it's easy to use and it has a lot of great features. And then just a few additional considerations for external memory strategies. So number 1, it's important to consider whether you prefer low tech, so paper and pen, or high tech strategies using electronics. For low tech strategies, some of the pros are that it doesn't malfunction, the battery won't die. If you have screen sensitivity, easier to use a paper, and it's simpler. It's just simpler if you're not familiar with technology. Some of the cons of the low-tech stuff are that you can't always bring a big day planner or a wall calendar everywhere with you. They can't give you reminders or alerts the way that a device can. We could lose and misplace them, and they aren't backed up in a cloud the same way that something electronic might be. For high-tech strategies, some of the pros are that we can get alerts. They're typically easier to bring with you, like a phone is a lot more portable, and you can often have it all in one. Your to-do list, your calendar, your checklist could be all on your phone. The cons of the higher tech ones are it could break or die, it can malfunction, and it's harder to use if you're not familiar with technology. The next consideration is that once we have established good external strategies for remembering the important things in our life, we need to remember to use the strategies. So to build a new habit of checking your calendar every morning or reviewing your to-do list every evening, for example, it's very important to build this new habit into your already existing routines. So if you are going to decide to write out a to-do list each morning, you will need to look at your current morning routine and decide where you could fit it in. You should add this into your routine right before or right after you do something that you always do, something that you never forget to do. So for example, if you never forget your morning coffee, you could plan to sit down with your morning coffee to write out your to-do list for the day. Attaching this new habit to a previously established habit will help you to remember to do it until it becomes a habit too. If you are worried that you will still forget to use your memory tools even when they are a part of your routine, then I suggest setting reminders or alerts using technology to remind you to use them, at least until it becomes automatic. My last point here is for external strategies is that more is not better. So please do not go downloading a bunch of apps or trying to have a to-do list on your phone, computer, and in a notebook. It's best to have just a few strategies that you consistently use. So you don't want to have different notes and schedules all over the place because then you are likely to miss something. Less is more when it comes to external strategies. So I would recommend just using 1 or 2 strategies or locations and keeping most things in the same place. Okay, so next we have internal memory strategies. These are strategies that we can use to remember something without writing it down or introducing something external to help us remember it. These are strategies you could use when you're not able to write something down, but you want to remember it so that maybe you can write it down later. Or maybe if you are studying for a test and you can't bring in a cheat sheet. So the first internal memory strategy we will go over is repetition or rehearsal, which is really just repeating the information to yourself over and over again. So this can be done out loud or in your head, and it helps keep the information in your working memory for longer. So for example, if someone leaves you a voicemail with their phone number and you don't have a pen handy, you could repeat it in your head 5 or 10 times out loud until you're able to find something to write it down. If you're in a room with other people, maybe you need to repeat it in your head, and that's okay. But if you repeat it over and over, you're more likely to remember it. This strategy works best with bite-sized chunks of information, so it will work better if you're trying to remember just one phone number instead of 2, for example. The next internal memory strategies to review are association, elaboration, and visualization. I often group these together because their underlying mechanism is the same, which is that if you think more deeply about something you want to remember, or you think about it for longer, you are more likely to remember it. So for association, this is linking what you want to remember, so something new, with what you already know, something old. This makes it more meaningful and it increases the chances that you will remember it. So for example, if you meet somebody named John and you are concerned that you might forget their name, you could associate their name to other things. So maybe John is also the name of your uncle, or maybe you are from St. John's, or maybe you like the musician John Lennon. So you need to find an association or a connection like this, and it can help you to remember it later on. For visualization, there is a saying that a picture is worth 1,000 words, and it actually can be extremely helpful to visualize or think of a picture in your head of what it is that you want to remember. It's good to include as many senses as possible. The more vivid your visualization is, the better chances are that you'll remember. So if you don't want to forget to take the garbage bin out to the curb when you get home today, you could shut your eyes and picture yourself doing it. Think about what it will look like, picture your front yard and driveway, think about what it will feel like. Is it hot or cold outside? Will the bin be heavy or light? Essentially, if we picture ourselves doing something, we're more likely to remember to do it. Lastly, we have elaboration, which is another way of thinking more deeply about something you want to remember. Elaboration would involve asking yourself questions to elaborate on whatever it is that you are trying to remember. For example, to remember an appointment, you could visualize how you are getting there. What are you going to do before and after? Who you might speak with there? What are you going to plan to wear or eat before you go? So just asking yourself lots of questions about what it is that you're going to do. Essentially, if you want to get better at remembering information, give it your full attention and try to find a deeper meaning within it. Now, because many of my clients report difficulty with remembering names, I wanted to quickly introduce you to an internal memory strategy for remembering someone's name when you first meet them. It involves using the strategy of repetition. We call it the SALT technique. So S stands for saying the name out loud. So when someone first introduces themselves to you, if you were doing the SALT technique, you would then repeat it back to them by saying something like, "Oh, it's nice to meet you, Cindy." Then A stands for asking a question using their name, such as, "And how is your day going so far, Cindy?" L stands for saying their name at least one more time. So, "I'm so glad to hear that, Cindy." And T stands for terminating the conversation using their name one more time. So it was great to meet you, Cindy. This repetition will help you to remember their name later on. Don't be afraid about it being awkward. People actually really like hearing their names, and it sounds pretty natural in conversation. And then lastly, I wanted to talk about functional memory exercises because people ask me a lot how to make their memory better. I'm sure we have all heard of brain games like Luminosity, for example. What the evidence has shown us is that we should be cautious of associating brain games with improvement in your day-to-day memory and brain function. While memory games like those found on Luminosity can help you practice some of the strategies, it is more important to practice internal memory strategies with your day-to-day tasks, such as remembering to take your medications. So we typically see improvement with practice of functional tasks versus isolated games, because sometimes getting really good at a game on Luminosity, for example, won't actually translate to you getting really good at remembering to pay your bills on time, for example. However, if you like doing brain games, you can still do them because they certainly don't hurt. I recommend using brain games as an opportunity to practice the memory and attention strategies reviewed here today. So taking short breaks, removing distractions, trying to remember things using association or repetition. If you practice using these strategies when doing a brain game, you're more likely to use the strategies in real life too. The last cognitive domain with strategies that I wanted to touch on today is executive function. And executive function is a big category because it controls so much of what we do. But for the next 2 slides, we will review just some of the many areas of executive functioning and how to address them. The first strategy is for task planning and completion, which often gets harder after a brain injury. And this is called the goal, plan, do, check method. The first step here is identifying your goal or your task. What is it that I want to do? We want this to be as specific as possible so that we can tell when we have achieved the goal. Then we make a plan. How am I going to do it? Your plan should be fairly detailed and include all the steps, really breaking things down into step by step. Try to think about what barriers you might face when you try to do your plan, and then come up with ways you can overcome these barriers. I recommend spending time on your plan and not rushing it. Once you have your plan, you can carry it out. So that's the do. And then lastly, you can check to see how well your plan went. So if you were successful, great. If not, where do you think it went wrong and what could you do differently? This will help to improve your chances of success for next time. Using this strategy makes something that is often automatic, like task planning, more intentional and can help with relearning the steps of tasks and how to get better for next time. My last point on the slide here is routine building. I just wanted to briefly touch on it because executive functioning also controls task initiation, which often gets more difficult after a brain injury and is really the first step in doing a task, is initiating it. We find that using routine building is a great way to improve initiation. So making sure someone has a visual plan for the day that they can follow can reduce barriers to getting started on a task. Also, if there is a consistent routine, for example, doing laundry every Sunday morning, this reduces the burden of initiation because things we do regularly become routine and therefore become more automatic for us. Lastly, if you are struggling with initiation and motivation, I recommend reflecting on your values, like what is important to you and how would you like to be spending your time, and then making sure that your daily plans line up with your values, because initiation and motivation are much easier to access if our actions are in line with our values, because then we are more internally motivated to do them. Okay, so our last executive function topic here is task prioritization. Prioritizing tasks and deciding which things you should do first is also something that executive functioning helps out with. If you are noticing you are having trouble with deciding what should be done and what should be prioritized, here are some suggestions for learning how to prioritize. You could try to use one of these charts on the slide here to help you decide what is important and needs to get done now versus what could be done later. Our first chart up here is the need, should, want, delegate. So you can make a chart like this and write the things that you need to do, meaning something that could not be put off to another time in the first column. The things you should do, meaning it would be nice to get them done soon, but you don't necessarily have to finish them today, in the second column. The things you want to do, meaning things that you don't need to get done anytime soon, but you'd like to get them done eventually, in the third column. And the things you can delegate, so ask for help with, in the fourth column. The second chart is similar, but it's do, defer, delegate, and delete. It has some differences though. So the do now column is for things that must get done ASAP. Defer is for tasks that are important but can wait a little bit longer. Delegate is for tasks that you could ask for help with. Delete is tasks that maybe you felt you needed to do, but when you think about it harder, maybe it's not necessary. So for example, if you say you need to clean the bathroom 2 times per week, could we delete one of those times and just clean it once a week? Possibly. The last chart, the colorful picture on the right side of the slide, is called the Eisenhower matrix. This is similar to the last chart we reviewed, but it is set up as a matrix with the x-axis, the horizontal, being how urgent the task is, and the y-axis, vertical, being how important the task is. So just remember, even when a task is important, it does not always mean it is urgent, and it's easy to get those things confused. If you or a family member struggle to prioritize tasks, I recommend trying one of these strategies to help you organize things and then take one step at a time. Okay, so OT strategies for communication are often very specific to the client, but I did just want to touch briefly on what these can look like. So the first one is supported communication. We will use supported communication for people with aphasia, such as pictures on the slide here with the yes and no boxes for somebody who's having trouble communicating so that they can point to them. It is important with supported communication to ask simple yes or no questions. I will also often provide coaching to the client and the family on communication strategies, including things like removing distractions so that somebody can focus on what you are saying. Speaking naturally and clearly, but not in a tone of voice that's kind of speaking down to them, like how you would speak to a child. And when communicating with someone with aphasia, it's important to acknowledge their competence. So you can say things like, I know that you know what you would like to say when they're struggling to come up with the words. If someone doesn't understand what you're saying, you can try to rephrase it or state it in another way. It's good to give ample time to people with brain injury to communicate in the best way they can, but we can also check in with them to find out if they prefer you give them time or if they want help with finishing their sentence. Everybody's different. I will also coach clients with aphasia to use resources available to them. So look up something online or pull up a picture to show someone if you think it will help them to understand you. You can use gestures, you can use facial expressions. I also encourage people with word finding difficulty to just give themselves time to think of the word, but to try not to stress too much about getting the exact right word, because the more we stress about it, the harder it is to think of the word. Sometimes you can say a similar word to get the meaning across and then come back to it later if needed. And then lastly, with a lot of communication concerns, I will recommend that a client sees a speech language pathologist because they are the experts in speech and communication. Okay, so our last slide here is on emotional coping strategies within OT. A lot of people don't realize that OTs can also address mental health, but our profession is here to help people overcome obstacles to daily living, and sometimes these obstacles are emotional or stress related. So in these cases, the common OT strategies are learning relaxation strategies like the breathing to help decrease physical activation and to improve coping. For example, I will review breathing strategies with people like diaphragmatic or belly breathing, which is a way of deep breathing that encourages people to take long, slow, deep breaths, and it can decrease heart rate and muscle tension. We also go over grounding strategies to help clients come back to the present moment to decrease distress. I can also provide education to clients on emotional regulation, anxiety, or depression, how it works in our bodies, and different ways to cope with it. Routine building, which I mentioned earlier, can also be used in OT sessions as behavioral activation, which is a strategy that helps with depression by getting someone gradually back to activities. When emotional regulation becomes difficult, so does communication, as we know. So sometimes I will go over strategies such as how to communicate assertively instead of passively or aggressively to help clients with getting their messages across in a more productive way. I can also assist clients with using body-based relaxation strategies for managing irritability or quick tempers. And lastly, when someone is having significant mental health issues and it's getting in the way of their daily function, I will often recommend that they discuss this with their family doctor and consider seeing a psychologist or a counselor. These are great resources for learning even more strategies for dealing with the stress of daily life and coping with the loss and grief often associated with a brain injury. So as a summary, we have gone over the many areas that brain injury can impact our ability to function, as well as the many areas that OT can help with this. I'm hoping at least one strategy here today stuck out to you as something you can try with yourself or with your family. If you are interested in learning more about OT or maybe seeing an OT yourself, I recommend you look it up in the city you're in to see how you can access an OT. Thank you to everyone for watching and listening to my presentation today. I believe we will now be opening the floor up to questions.
Thank you so much, Kaylee. That was so informative, and we so appreciate the time you've taken in order to present that to us. Yes, we're gonna do a few questions now. So if anybody has any question about what was talked about, or any kind of thing pressing on your mind about, what maybe you're aware could be experienced after having a brain bleed or hemorrhage with cavernous malformation, go ahead and put it in the Q&A. But our first question is, can you tell us what the difference is between a traumatic brain injury and an acquired brain injury?
Yes, I believe I know the answer to this. Someone might want to fact check me after, but what I believe the answer is that an acquired brain injury is a more broad term. Traumatic brain injury is a type of acquired brain injury. So I believe a traumatic brain injury is when there was an external force to the brain causing a brain injury. Whereas an acquired brain injury can include those, but could also include strokes, which would be considered an acquired brain injury, but not a traumatic brain injury. I believe that's the answer.
That's okay. Great. Thank you so much
Yeah.
for that. Another question that we have is there a specific time frame after a brain injury, an acquired brain injury, such as a stroke or brain hemorrhage, or something happening to injure the brain, in which someone should be seeking some of the strategies that you talked about today? Is there like a specified time frame? Does it matter how long you wait? And maybe you can kind of shed some light on that.
Yeah, absolutely. So after a brain injury, there's many different phases of rehabilitation. So the first phase oftentimes occurs in the hospital. And this is when you're trying to get back to being able to go home. So they are really only focused on the very basics of daily living stuff. Whereas the stuff I've presented here today are more for when someone's already home and now they're trying to progress into maybe going back to work or school, or even just getting back into hobbies they enjoy. So in terms of timeline, it's never too early to, start doing rehab and try this stuff. But with the stuff I presented today, this stuff is often more helpful once you are back in your environment and trying to settle back into a routine and daily life. But seeing an OT happens at all stages after a brain injury. You'll probably see one in the hospital, and then maybe in inpatient rehab, and then in the community. So OT can happen at any stage, but the strategies I reviewed today, depending on the strategy, are often more for clients that are in their long-term phase.
Okay, great. No, that's good to know, because sometimes people might feel like they haven't heard from anybody about accessing community, OT services, or help with their memory challenges, or how to find the things that they used to be able to see and find before they had
Yeah.
their brain injury, and especially that kind of fatigue that happens as well, and they might be feeling a little bit forgotten. So it's also important for people to know that, it's not unusual that, you might be referred, or start things like that a little bit after you've been home for a while.
Yeah, and you can seek it out yourself too. Sometimes there is a little bit of a gap in care. You get discharged from the hospital and they say bye, and you don't always get all of the referrals that maybe would benefit you. So, yeah, if you haven't been referred to one, I recommend looking into it. There is a little bit of a gap. Not every city and every province has a lot of affordable OT in the community. There is OT in the community, but it's not all affordable. So, depends on the person.
Yeah, that's a great point. And thank you so much for sharing that. Also, is there any situations in which someone may have, like an OT may have more experience or knowledge in working with brain injury, as opposed to other reasons why someone might need OT? Like, is there any differentiation in like their training or anything like that? If someone's looking for one, where would they find, if they were looking it up themselves, someone who's an OT that works specifically with brain injury? Any tips on that?
Yeah, so everyone who's an OT did the same schooling, which included brain injury, but we learned so much that I would say that the real expertise comes afterwards and experience with working with people with brain injury. And so if you're trying to find an OT in the community, a lot of provincial organizations. So I know in Alberta, there's the Society of Alberta Occupational Therapists. They have a list of all of the OTs that are in private practice. And on the list, it sometimes says what practice areas they do. So that could be a good place to start. But also, you could reach out to them and say, hey, what experience do you have in brain injury? And I often recommend doing that because there is a very big range of specializations. And so, if you are spending the time and money and energy to see an OT or any healthcare provider, I would recommend asking them for their experience with brain injuries and picking somebody that you think is the right fit.
That's a really great point. And for everyone here tonight and anyone who's listening later, we at Cavernous Malformation Canada have access to all the resources for every province in terms of the brain injury associations there that can probably assist with getting someone in the actual locale that you live in if you want to access a brain injury occupational therapist or any other services related to brain injury as well. Well, Kaylee, I can't thank you enough for coming tonight and taking your time to do this for us. I believe that's all the questions we have so far, and I think that probably we'll be able to call it an evening. But thank you again so much, and everyone, this will be up on our YouTube channel and posted to our social media in about 2 weeks' time, as soon as we go through the captioning to make sure that certain words are all coming out okay. So thank you again so much, Kaylee, and thank you for everyone for coming tonight. We're greatly appreciative. Have a
Thank
great rest of
you.
your evening. Okay, thank you.
Bye bye.
Bye.